Yeah, Amber, I talked to an emergency nurse who, like many of us, were taken aback by seeing all the devastation in western North Carolina. She says there were numerous patients there that had nowhere to turn to, but fortunately, there are still hundreds of people like her who are still there serving the area.
It's a catastrophe. It's devastation that very few people in my lifetime have experienced and seen.
Megan McCormick spent nearly 4 days in the western part of North Carolina, where Hurricane Helene left behind a trail of destruction and numerous people needing help.
Countless patients were coming in just because they didn't have oxygen. Patients that their medications were missing had been washed away or buried in mud, coming in just because they wanted their medications refilled, just so that they didn't have to come back to the hospital.
McCormick is just one of hundreds of healthcare workers who left the Triangle to help out. WakeMed and Duke Health sharing some of these photos of their response with hundreds of more volunteers on the wait list to be deployed.
People are in the middle of this disaster that's out there right now, and trying to connect the people who have the need with the resources can be challenging sometimes, especially in the early parts where we saw there was a lot of communication gaps with cell phone coverage and other things that were a challenge in the early parts. And so connecting the people to the resources is always a challenge at the beginning of any disaster.
But staffing is fortunately not a challenge for these healthcare systems, who say they're overwhelmed by the amount of people coming in to help.
We still have a long list of our teammates that continue to want to volunteer.
Whether it's somebody who's on a ventilator or who needs oxygen or needs support at home, it's always a place where they can go and get caring arms who are going to take care of them and make sure all of their needs are met, while other groups are trying to help them with the long-term sustainability of their community.
And so, as we've heard some people say before, this is going to feel like a marathon as towns rebuild. And one of the concerns that McCormick has is the upcoming weather, and when it gets colder, she's worried about people and their access to health care, especially after some of these landscapes completely changed after Helene.